Good afternoon. This time I'd like to provide you today's information about the status of COVID-19 in our community. As of 2:30 today p.m., we have 13 new cases. We have total cases in Victoria County of 481, 223 recovered, 250 active, and right now we have 17 Victoria County residents hospitalized. Keep in mind, as we announced last press briefing, we do currently have widespread community transmission of COVID-19. I want to address a few issues going forward. First, actually, I want to introduce the folks we have here in the room. Today you're going to hear from myself, Rick McBrayer, and Dr. McNeill. Afterwards, Mayor McCoy, Thomas Gwosdz, our city attorney, and Jesús Garcia, our city manager. They'll address the City of Victoria orders requiring additional hygiene measures. Now I'd like to address a few other issues that I want to point out today, and some questions we've had come up on social media and other avenues. We've had some questions regarding testing numbers and whether our current increase in cases are due to those testing numbers. Right now, the spike we're seeing, I can confirm, that aren't due to a massive increase in testing. Sure, we've had more tests going on and taking place because we have more cases in our community, but truly those tests are due to the more cases we do have and the increase there. Right now, those folks I ask you to be, if you're getting a test done, you be patient. We are seeing delays in testing results right now from the labs, upwards anywhere from 2 to 7 days plus in some cases. So we ask that those folks that have tests outgoing that you be patient, and while you are waiting test results, we do ask that you stay home and isolate yourself and quarantine and do not go back out in public if you're awaiting a test result. A few other issues we have questions about regarding the probable case definition. We've had some questions about that. I did address that a little bit last Tuesday during the press briefing. What we are considering in Victoria County, all our 481 active cases, all but one of those are lab-confirmed, lab PCR confirmations of positive test results. We have not included positive antibody test results in that number. If we do get a positive antibody test, we're advising they do get a PCR, which is a nasal swab, and get that case confirmed that way. Right now, all but one case we have reported are all PCR confirmed. There's only one probable case. And again, that's due to a high-risk exposure that is showing signs and that wasn't able or refused to get tested. And that is the only probable case we are reporting. As I stated before, if you're awaiting tests, please stay at home and isolate. We've heard results of folks that are going out in the community awaiting test results and continuing doing what they're doing. We ask that they continue isolation even if they're waiting. And also, if you've been ordered to quarantine or isolate and you do receive a negative test result, still, you need to stay home and wait out your quarantine until you're advised to be released. You could test negative even though you still may later develop in the next few days, develop the virus and be positive at that time. So please stay home and finish out your quarantine. With that, I'm going to turn over to Rick McBrayer, and he's going to update and give you some information regarding the community center testing site.
Great. Thank you, David. Once again, Rick McBrayer, I'm the Emergency Management Coordinator for the city and county both. So the last 2 days, we have been partnered with Department of State Health Services and our Texas Military Department to run a community collection site. It's a walk-up test site that was there at the Victoria Community Center. On Thursday, we ran from 8 o'clock in the morning till about 4 o'clock in the afternoon with 747 samples that were collected by the Texas Military Department. This morning, we started off a little before 8 o'clock. They were able to open the doors a little early. And so we went from 8 to noon with 492 samples being collected. And so it was a great success to have the partnership there with the Texas Military Department and also the Department of State Health Services. Texas Department of Emergency Management were partners with us as well. And so we had a total of a little over 1,239 samples that were collected and throughout the last 2 days. And so that site has now been closed down. Texas Military Department also came in with a sanitation crew and went in and did a complete sanitation of the actual community center itself. And so I'll entertain any questions here in a few minutes once Dr. McNeill gets done talking about his. So.
Good afternoon, everyone. There's just a couple of things I want to talk about, and then we'll open it up for questions, and you can ask any of us anything you want. For the most part, we are at widespread transmission right now, and this is community transmission, and this is the thing that we've always worried about. We're seeing a lot of cases. Y'all know the numbers. We've had more cases in the last week than we've had in weeks before. So, and that's not just in Victoria. Texas is one of the hardest hit states in the nation, and we're seeing those numbers. Those numbers are readily available. But what we have to understand is that the more the virus is out there, the easier it is for it to spread. And so remember, this virus is looking for a reservoir, and we're a great reservoir because no one really has any immunity to this specific pathogen. So these people, it's just easy for the virus to live in our community. And as I've said many, many times, we have got to be able to stop this virus, and the only way we can stop it now is social distancing and wearing a mask, okay? Remember to keep your hands clean. It's the basic whole hygiene thing, and I know I say this over and over. Now, we know that there's going to be some orders that the mayor has done, and for the most part, I mean, these orders are complex. It's hard to make a one set protocol or one set order for everyone. But a lot of people have asked me, do you agree with these orders? And I'm going to get out in front of it right now. And I'm going to tell you this. What I agree with are the standards that the Centers for Disease Control says. And the Centers for Disease Control says over and over, and I would say almost from the beginning, but it wasn't from the beginning, but the Centers for Disease Control says that wearing a mask will decrease the transmission and the acquisition of this disease. So I believe that wearing masks are good, and I believe that when you're in desperate times like we are right now, this is all over the community. It's everywhere. And remember, if you go out and you don't social distance and you're with a bunch of people like in a crowd that you don't know, there's a very good chance that you're going to be exposed to COVID. And there's a very good chance that you're going to get it. And from there, nobody knows what's going to happen to you. There are young, healthy people that do very well. There are elderly people that do very well. But there are a lot of young, healthy people that get very sick. And we've seen deaths in young people as well. So, of course, it's more likely to happen, and the results are usually worse in elderly patients or patients with multiple comorbidities or a lot of things wrong with them. But just the idea of thinking that you're young and that you can go out and if you get the disease, you'll probably be okay, maybe so, but why roll the dice? That's what it's all about. So as far as wearing masks, I think that wearing masks is a good idea because I believe that it slows the spread of disease. Okay. Now, there was another thing that I mentioned the other day very briefly but obviously it's still a topic, and I want to talk about some of the stuff and some of the misinformation that's out there. And a big thing going around on social media right now is that if you wear your mask too long, you can pass out, or that you cannot get enough oxygen, okay? I'm told that there was an accident and the guy was trying to claim that he was wearing his mask and he retained too much carbon dioxide and that he passed out, okay? Retaining too much carbon dioxide. Remember, when we breathe in oxygen, but we breathe out carbon dioxide, and both those things are very important. And one of the things that we see in medicine a lot of times is that people don't breathe well, and they start retaining carbon dioxide or CO2. This is called hypercapnia. And there is a thing called hypercapnic cardiac or respiratory arrest where people can stop breathing from it. But it doesn't happen with a mask. And I'll tell you physiologically why. It's real simple. The CO2 molecules are smaller than the COVID molecules. Carbon dioxide freely goes through these masks. It goes through facial coverings. It doesn't even slow down for facial coverings. And even N95 masks, even if it's well sealed, you will still be able to exchange or diffuse carbon dioxide through those things. So you're not going to retain carbon dioxide from those masks. It's not going to happen. Now, will you rebreathe some warm air and feel a little stuffy? Absolutely. Try wearing one for 12 or 14 hours at one time. So it will happen. We've all had that feeling. So there is no danger from that. And just like everything else in medicine, it's a risk and a benefit. And trust me, the benefits of wearing masks greatly outweigh the risks. Okay. The last thing I wanted to say, I want to talk a little bit about our hospitals. And, this is the thing that we talk about. And this is what we worry about when it comes down to the whole pandemic and all the different steps, a lot of different steps, surveillance, treatment, all the monitoring we do, the ways that we can take care of sick people. There are a lot of different facets of this disease. But one of the things that we have to understand is that you have to be able to get care when you need it. And you can still get care at the hospitals. Now, we all know that Citizens had an outbreak in their OR and in some of the areas right around that. Well, that's been contained, and that's been well done. In fact, Citizens even took the extra step. I know this because, of course, I work there. But they even took the extra step of closing the operating room for non-emergent cases until after the 4th of July. So Everything's safe. I don't want people to not go to the hospital, any hospital, when they need help. We've seen that. We've seen patients that have had heart attacks that didn't come or get help in time. They end up with something that could be easily treated. A good example, a little shortness of breath, a cough. They don't go to the emergency room because they're afraid they're going to get COVID, and they've been staying home so they don't suspect they've got COVID. But they don't want to go anywhere because they don't want to get sick. Well, that little bitty cough turns into pneumonia, then they end up in the hospital for a week. So we're seeing a lot of hospitalizations that probably wouldn't have been there or wouldn't have happened had people gone to the emergency department when it's safe. The ERs are safe, the hospitals are safe, and I don't want anybody to do poorly because they didn't seek care because of that. Okay? So those are the main things I wanted to go over. David touched on the idea about the positive COVID cases, and all of ours, with the exception of one, have been proven PCR tests. In other words, they had the most accurate test that we have. We don't call it a case until we're sure it's positive. Some patients, we know before we test them that they're going to be positive because it's the old, if it walks and talks like a duck, it usually is one. So, but anyway. Okay, that'll open it up pretty much for questions, and either for Rick or David or myself, or, yes, sir.
Sorry. No, you can go.
David, just quickly, so 17 patients in the hospital, is this more than county residents in the hospital, is this more than we've had at any time in the pandemic so far?
I'm trying to think back to when we had the outbreaks. I think we're close, if it's not the highest, I don't know for sure off memory, but I think it's pretty close to that. During the outbreaks we had at PAM, it may have been near that number, just due to the number of patients in those facilities, but I think we are probably the highest, if not close to it.
For Rick, I'm curious, and apologies if you had mentioned this, I forget, but are there plans for a second wave of testing at that site?
No, not right now for Victoria County. So the question was, is there an opportunity for a second testing day or set of days for her, Victoria, and city and county both? No, not at this time. The Texas Military Department will work with the Department of State Health Services and rotate through our various sister cities and sister counties and installing those there at those locations. So,
And both for you, David, and Dr. McNeill, what is your level of concern with the widespread community transmission that we have right now with the 4th of July holiday coming up here?
Yeah, I'll take on that one, Dr. McNeill, finish up. A lot of concern, great concern, just like we had with, Memorial Day back before we really had the spike, with Father's Day, last week, and with July 4th. The holidays, we all like to get together and we like to celebrate and we like to go in social settings. So definitely, it's a great concern. We just really advise folks that, one, if you're sick, please do not gather around families in large groups, stay home. And if you do want to get together with family or friends, just really be cognizant and be aware of how you're celebrating and do what you can to distance. We obviously don't expect to wear a mask at a backyard barbecue. I mean, we're practical, we understand that. But just be aware who you're around, be aware who you're exposing. Don't go around those that are medically fragile. Don't allow them, don't subject them to large groups and gatherings, is the best advice I can give. And Dr. McNeill wants to, touch on that as well.
Well, the best thing would be to just, if you're going to get together with anybody, of course, the first thing I say is try to avoid it if all possible.
Mm-hmm. Right.
But if you're not going to avoid it, then make sure that you socially distance. Don't all eat at the same table. There's countless stories of families that have had one person sick and they infect 8 or 10 people. And unfortunately, some of them are the older ones. There was the story in North Texas. Y'all probably read about that one. And those poor people ended up with 18 or 20 people positive from one birthday party. So it's just not worth it. There's going to be another 4th of July, okay? And there are going to be 4th of Julys, hopefully forever, without COVID, all right? We're working hard on a vaccine. Next year, I hope it's going to be a different landscape and a different picture.
Yeah, and I should have prefaced it with that, ideally don't do it, don't gather.
No.
But if you do, like our,
He's just a little more realistic than me.
Yeah, well,
So I'm trying to, whatever.
David, has the total number of citizens employees infected by the outbreak, has that changed at all since yesterday?
I'm not aware of an increase. I can definitely double check and get back to you though.
Okay,
Sure.
okay, thank you.
That is stable and has been stabilized.
Okay.
All those patients have been sent home.
Okay.
And so that's they've been overly cautious. They tested over 90 people today, and actually they've tested right at 100 more people today. They repeated their testing after the initial test just to make sure.
Okay.
And then they closed the operating room for another week. So,
Dr. McNeill, as local public health authority, you have the power to order people to quarantine and isolate. Have you had to use those powers at all lately?
we've written several letters to people just I guess you could say friendly reminders. But I tell you, we've said from the very beginning that if we identify an individual that is blatantly disregarding those orders or doing something that I feel or David feels that is danger to the community, we will intervene.
And one thing on that too, the governor stated that, and the commissioner of the Department of State Health Services, once you confirm positive case, you're basically under a blanket control order at that time. So every positive case from here on out is going to be under a control order. And like Dr. McNeill says, if there's identified issues that we can pinpoint to a case, then we'll definitely pursue further actions.
In the recent instances of community transmission that we've seen, have there been issues with false negatives contributing to the widespread community transmission?
Keep in mind with ours, the cases we're counting are all PCR positive. Some of the issues that we had, Dr. McNeill may be able to touch on this a little bit as well, were for some reports on a national level with a certain rapid test that were getting false negatives. Anytime, from what I understand, the labs, what they're doing, and for us too, if we have a close contact, if you do receive a negative rapid test, we're still going to ask you to go ahead and follow up with a PCR as well, with the nasal swab, and that's going to be the lab confirmed. It's going to take a few days to receive results. So could it be contributing? Possibly. I mean, I can't really speak directly on it, but it's definitely a possibility. It could be one of many things that are contributing to the widespread transmission.
A lot has changed since obviously the stay-at-home orders. Many people have gone back to their regular routines. If people can work from home, should they?
Yeah.
Absolutely.
Yeah.
And, I mean, we're just talking about trying to limit people's exposure to the virus, and the best way is to just not be there.
Dr. McNeill, could you address, what patients in the ICU, are they primarily suffering from ARDS, or what are they experiencing?
Well, this disease unfortunately has a pretty, well, I won't say predictable because nothing's really that predictable, but a lot of these patients do decompensate and they end up with viral pneumonias, and this disease directly attacks multiple organs in the critical phases with the cytokine storm and the things that we've talked about before. We see a lot of respiratory complaints and a lot of respiratory problems, and that's pretty much the one factor that when we see somebody, like if we see them in the emergency department and they're sick and they're COVID positive, their respiratory status and their ability to maintain their oxygen saturations are the numbers that we really look at. If they can't maintain their oxygen, they need supplemental oxygen, they're put in the hospital, and then they're watched closely because we know that a certain percentage of those people will decompensate, and it usually is pulmonary or lung involvement.
And you've said previously that just given the increase in cases, we can probably expect more people to need hospital care. Do you think that the kind of advance notice that we have is going to help our hospitals be more prepared? Or I guess how do we avoid what other parts of the country have experienced in terms of overwhelming our healthcare systems?
Well, I've said from the very beginning that we've been able to learn from what happened in New York and on the East Coast and in the endemic areas in the beginning. I mean, they were kind of caught by surprise. For one thing, we have a lot more ventilators available now. A lot of the equipment from up there has been able to be moved down here. There's been a lot of talk about the Texas Medical Center and as far as what their readiness is and their availability. They're doing a good job. They're trying to get everything together. I will tell you this, that I was on a conference call this morning with 30 or 40 or 50 other ER medical directors, and I can tell you that there are some scary stories coming out of the bigger cities, and specifically in Houston. I mean, they're talking about ICUs already full. Yesterday, supposedly, they were at 97% full. What I'm worried about, and you hit it right on the head, is that this progression of this disease. You start off with the mild symptoms, a certain percentage are going to get worse, and a certain percentage are going to get into the hospital. The problem is that the bigger the base number, the bigger the percentage is going to put more patients in the hospital. I'm really worried about our resources in the next 1 to 2 weeks.
We have time for one more question.
I was just going to ask, I know we've touched this before, but masks have become divisive amongst some communities. I mean, is there another medical intervention you would compare it to, or a way that you can perhaps explain it as an effective intervention in terms of stopping the spread?
Well, we all know that, here's the thing. This is spread by droplet theory, okay? This blocks droplets, okay? So this isn't even the real fancy one. I mean, there are nicer ones than this. I see some pretty nice ones out here. but I'm gonna ask you where you got that later. But some of them are pretty. They're all effective. I mean, to a certain degree. And remember, we've said it 100 times. You're not just protecting yourself. You're protecting the people you're with. And I mean, if you can stop those droplets from coming out of you, and you can have another mask. I mean, really, if everyone's wearing a mask, that coronavirus has got to go through 2 specific barriers to get into you, as compared to just someone you're standing there talking to without masks. There is no, I don't care what they say, there is no science-based justification to say, I don't want to wear a mask. And I'm sorry if you feel like your civil liberties are intervened or interfered with. That's not my job. My job is medical and public health, and I can tell you that from a public health standpoint, wear a mask.
Thank you. All right, next up will be Mayor McCoy, City Attorney Thomas Gwosdz, and City Manager Jesús Garcia.
Okay. First and foremost, I would like to get something off the table to begin with. I don't want the fact that I took this action unilaterally to be interpreted as any sort of issue between the judge and mine. I wanted everybody here to know that Ben Zeller is a friend of mine, a dear friend of mine, and this has nothing to do with anything between us. I respect the judge immensely. I go through a decision-making process that he goes through himself, and I just felt the urgency to do what I thought was necessary yesterday. And I'll begin to say some of the reasons of why I took action. First of all, it was a large surge in cases that we've been seeing over this past week. I think it's very apparent that the numbers were going up, not even here in Victoria, but in surrounding major metropolitan areas where people go to and come from. Another large thing that was huge, what was important to me, was that the support of the Chamber of Commerce, when we went to them, met with their executive committee, and then their board decided to pass a resolution supporting the concept of their members requiring masks in businesses. Another thing that was important to me is I actually got a call from one of our larger retailers, HEB, and they were mentioned to me that they would be appreciative if some action were taken as well. So that was a big factor. Along with the amount of other people contacting me, people that I know and have associated with for many, many years, including many professionals, many other citizens, and several doctors that I know as well. And I can assure you that I've had multiple conversations and other communications for the past week with David Gonzales and Dr. McNeill on a daily basis, and even as of yesterday on an hourly basis to get updates of everything that was going on. Since the end of the day on Thursday of 6/18, we had 248 total cases in Victoria as of 6/18. 1 week later, at the end of 6/25, that number jumped to 468 total cases. That same September 18th, we had a total active cases of 77. And as of yesterday, the total active cases were 238. And one of the big numbers that I kept requesting throughout the day from the health director was, how many ICU beds do we have available in Victoria? and we had 12. So that was another huge factor in my decision to operate and do what I did, take action. What you have to understand is when you have that few ICU beds, and I think Dr. McNeill alluded to it earlier today, about it's not just COVID patients that are taking up those beds. You've got to understand that if we would have, say, a major accident here in Victoria over the 4th or something like that, with that limited a bunch of ICU beds available, we've lost the ability to send some of these patients, life flight them to other metropolitan hospitals because they're filled up as well. And then if that should happen, we have a problem, a big problem. So that's what kind of prompted me to move forward as I did yesterday. Now, a little bit about the orders. Since this is a public health issue, an emergency, my orders are primarily issued under the authority granted me under Section 122.006 of the Texas Health and Safety Code, various sections of the City of Victoria codes of ordinances, and lastly, under Section 418 of the Texas Government Code. I think it is important for me to note that the authority available to me under the Texas Health and Safety Code is an authority not available to a county judge. Our city attorney will later comment on specifics of the order and answer questions as to those specifics. The primary purpose of this order is to provide the greatest degree of protection available to the citizens of Victoria, consistent with the limitations imposed by the governor's executive order. It is not just about masks. The order is about additional hygiene measures. The order is generally crafted around similar orders issued recently in Bexar and Nueces counties, with the inclusion of specific orders relative to City of Victoria properties. And now our city attorney will address orders issued earlier today by the governor relative to bars and group activities. Mr. Goosh.
Thank you. In addition to what the mayor has already described, his order signed yesterday also imposes mandatory face mask requirements inside of city buildings. So any city-owned facility within the city limits is now requiring masks for all visitors to the building. So if you have city business to do, please keep that in mind. This morning, Governor Abbott issued a new executive order numbered GA 28, which closed all bars effective noon today, reduced the capacity of restaurants back down to 50% effective on Monday, and prohibits group activities outdoors to groups of less than 100 people. If you have an event planned with more than 100 people, you can still have that event only if you have permission from the mayor within the city limits. If your event is scheduled outside of the city limits, you can seek authority from the county judge. Additionally, the order also puts limits on tubing and rafting activities and bans those being used, which may impact our community as well. And I'll be able to answer any questions when we open up for questions.
Okay.
All right, good afternoon, everybody. As Thomas and the mayor mentioned, city facilities are being impacted, and just 30 minutes ago or so, we put out a press release to communicating to you and everybody who might be tuning in about some more positive cases that we've experienced within our own family at the city. For those that are not familiar, my role as city manager is to serve as a chief administrative officer for the city, and so I feel responsible in a sense of duty to the over 600 employees that we have at the city. And so because of that, we felt it was important to be transparent with what we're facing internally as a family. We put out that we have 4 employees this week that tested positive. You may recall that back in April, we had a firefighter paramedic that had tested positive as well. And I'm sure people are wondering, what departments are these individuals with? And so I do want to provide that information to you. From the 4 that we had this week, there was a second paramedic firefighter that was part of that group. We had an employee within our Parks Department. We had an employee within our Environmental Services or Solid Waste Department. And we had an employee within our Public Works Department. I will say that all employees are in good spirits, are in good health. They're isolating at home. Obviously, this is one of those situations where hopefully their symptoms, don't grow too much and don't become too severe. And we've taken all the precautionary measures that one might expect, that any employer, I would imagine, hopefully expects, in terms of doing some contact tracing internally. We've communicated with the employees that they might have interacted with closely. I can't say with confidence that all 4 employees did not get the virus from interaction at work, and so they all have ties to some other activity outside of work, and they all have very minimal interaction with the public. However, we do obviously want to be cautious, and I do also want to be transparent with all of you that we have established a policy that, or are in the process of establishing a policy that would require employees, to get tested, especially those that have come in contact. And I can tell you that we're currently awaiting 21 tests of employees that have gotten tested, and so we're awaiting the results of those, and we'll be transparent with the results of those. As Thomas mentioned, we will be requiring, beginning on Monday, that everybody coming into a city facility wear a facial covering. We're cognizant of the fact that not everybody might have a facial covering, and so we will be prepared with personnel at the entrances of some of our more highly trafficked facilities, such as the library, City Hall, 700 Main, where people would be able to check in and potentially get a mask if they don't have one, to conduct the business that they need to conduct with the city. As the employer, we're also in the process of evaluating our overall operation. My priority is the safety of our employees, and I'm glad that the mayor took the action that he did, because like many employers, like HEB and others that he referenced, we had concerns as an employer of people that were coming into our facilities without a facial covering and what that might do in terms of risk for our employees. And so hopefully with everybody wearing the facial covering, not only are our employees safer, but the public that comes into our facilities are as well. In that light, and in the light of reviewing our protocols, effective this week, actually, we started with the budget workshops that we had with City Council this week. We will resume having our City Council meetings conducted via Zoom. And so that information will be posted with those agendas as they go out this month. And we do encourage people to tune in to that. We're not removing our citizens' ability to communicate with council. That opportunity still exists through the Zoom mechanism. It just requires, I guess, a little bit more technologically savvy folks to handle that process. But we are going back to that, and as I mentioned, we're reevaluating other aspects of our operation, and we'll obviously communicate those as they come to be. And I'm available to answer any specific questions you might have related to city operations or city facilities, and obviously the mayor for answering questions related to orders, or Thomas on interpretation questions. And so at this time, I'll open it up for questions.
Mr. Mayor, your orders yesterday apply. They require face masks for employees of the city and the public while in city facilities and buildings, but recommend face coverings or masks for businesses, or do they also require them?
They're two separate elements to it.
Okay.
The first element that, do you want to handle this? Or you want me to do it? Let me tell it in general.
You go ahead.
The first element of it has to do with what I can do under what the governor's orders are. And that applies to having businesses require their employees wear masks, develop a hygiene plan, which is included in that process, and to require that their patrons wear a mask. And they have to have a plan in place to hygiene. Now, read the order. There's very specifics in the order about the mask when you can't do social distancing. So it's very specific there. The other element of the order is a authority that I have independently of the governor to order city buildings and facilities to have our employees and those entering them wear masks. So under that order, it's exclusively under my authority. The other component of it is under the governor's overreaching order.
And I'll extend that a little bit. I think it's a great question. That there appears to be a distinction in the way we're handling city facilities versus other public buildings and businesses throughout the community. Remember that in the governor's orders, there has been a prohibition against local governments directly requiring masks. And so we cannot require masks to be worn throughout the community. However, the governor has included in at least his last 2 orders the ability for businesses to implement additional hygiene measures. That's the phrase that's used. And many communities before us have interpreted that to mean that the city can require a business to implement those additional hygiene measures. And that's what we're requiring here. What's different about city facilities is that when the mayor is responding directly to city facilities, we are the business. We are managing our own facility at that point. And so we're imposing our own hygiene measures that include the requirement of wearing face masks. The additional hygiene measures policy that the mayor's order has implemented does require that businesses, at a minimum, include face masks, or I keep saying face masks, but of course we mean facial coverings as well, right? I should clarify that. That businesses do require their customers to wear facial coverings when they're not able to be separated by more than 6 feet. Just as us sitting here are separated by 6 feet and we can take our masks off, if you go into a restaurant and your party is sitting at a table and your table is more than 6 feet from all of the other tables and all the servers, then you can take your mask off in the restaurant as well.
For both the governor's orders regarding bars and restaurants and the mayor's order, what departments or agencies or offices are responsible for enforcing those orders?
Just like any other regulation or law enforcement, the various different law enforcement agencies have authority to enforce those orders.
Okay. And for the governors as well?
Correct.
Okay.
Yeah, and, recall that months ago when a lot of these new orders were coming out, and you may recall the conversation about what's essential, what's not essential. There's been a lot of work on the background through collaboration between our different law enforcement agencies and, quite frankly, even our fire marshal's office to develop a pathway forward to educate the businesses on those orders. And so we have those structures in place already. And so what we envision happening is our law enforcement personnel, along with the fire department and others that made up that task force, to do the same thing in this case, to go around the businesses, educate them on the orders, just to kind of keep tabs on them. Obviously the intent of what the mayor has done is to hopefully get folks to follow the orders, but hopefully willingly, right? And so our hope is that by reminding folks, making people aware of it, that they'll comply with the orders. And so we'll take the same approach this time that we've done previously.
In the event that somebody isn't willing, so say a customer either refuses to social distance or refuses to wear a face covering if they need to, what should a business owner's next step be?
Well, I think
Call the law.
Well, keep in mind that businesses have the right to refuse service to whomever they like, right? And so it'd be no different than a business refusing service to somebody for not wearing a shirt, not wearing shoes, or for whatever reason, quite frankly. And so this would be no different. I mean, the onus would be on the business to do what they need to do. And so if a business feels like they have an individual or individuals that are not following the rules or policies that they have set in place, well, then they have all the legal authority in the world to have that person removed from their business. It's their right as the business owner.
Correct. Yeah. I'd like to make one last comment on all this. What I'd like people to understand is the issue, the intent of this order, and I wish that and I know that what the goal of the city of Victoria is to do everything within our power to allow businesses to stay open and do so safely. And that's putting it in a nutshell. Thank you very much.
Well, and just really quickly, I just want to throw out a couple of reminders. As a reminder, every day, staff post updates on daily counts and daily cases, and so be on the lookout for that. That information, as well as copies of a lot of these orders, will be on our victoriatxoam.org website. We've also kicked back up the hotline, and so that hotline will be open Monday through Friday, 9 a.m. to noon, and then 1 p.m. to 5 p.m. And as a reminder, that number is 361-580-5796. And so with that, we'll conclude today's press conference. Thank you.